Welcome to part 4 of our OVET video series, Assessing Dehydration and Heat Stress in Your Horse. In this series, we have been talking about the importance of hydration to maintain health and achieve the desired level of performance from your horse. Dehydrated horses do not perform well. So how can you determine if your horse is dehydrated and should have some degree of rehydration prior to work and competition? One simple way is just to be aware of the duration of transport activity that leads up to the competition or training session. Each hour of activity has the potential to result in clinical dehydration, that is, a 5% loss of total body water. This will result in impaired performance compared to a well-hydrated horse. Therefore, with any activity of 1 hour or more, it is highly likely that hydration strategies need to be used to maintain or restore hydration in your horse. In addition to keeping track of time spent doing activities, there are a number of indicators or tests that can also be used. These tests include the capillary refill test, the skin tenting test, monitoring heart rate, monitoring respiratory rate, and monitoring the depth of breathing, and monitoring rectal temperature. The principle behind the capillary refill test and the skin tenting test is that dehydration results in a decrease in blood volume, so the time needed to restore blood flow to an area where blood flow has been briefly stopped takes longer. In a well-hydrated horse, the capillary refill time is 1 to 2 seconds, and after pinching the skin into a tent, recovery time from this is also about 1 to 2 seconds. If the time for these tests is 3 seconds or longer, then the horse is likely clinically dehydrated and strategies for rehydration should be used. The horse should not continue to perform more than light activities. We have a link to videos for these tests at the end of this video series. The heart rate can be monitored using a stethoscope or a heart rate monitor. To assess dehydration and heat stress, a resting heart rate should be taken at least 30 minutes after completion of exercise. You should know the normal resting heart rate of your horse under cool conditions. It should be between 35 and 50 beats per minute. If heart rate is more than 60 beats per minute and stays over 60 for more than 15 minutes while at rest, this is an indication of stress. This may be due to dehydration or heat stress. You should also know the normal respiratory rate or breathing rate for your horse under cool conditions. It is usually between 10 and 24 breaths per minute. The breathing rate can be measured by counting the number of flank movements or nostril flares. When breathing rate is elevated, say 30 breaths per minute or higher, this is also an indication of stress. If breaths are shallow and breathing rate is high, for example, the horse appears that it is panting, this is an indication of heat stress. Like dogs, horses can get some cooling through panting, but when horses pant, it is time to get them into a cooler environment, employ rapid cooling strategies, and closely monitor rectal temperature. Rectal temperature is easily and safely measured using a digital thermometer. Your horse should be accustomed to being touched around the head of the tail and having a blunt probe inserted into the anus. It can be beneficial to have a string tied to the thermometer so that if you have to let go of the thermometer, it can easily be retrieved. A rectal temperature is not a measure of the core body temperature because it is not close to the core and it is rather close to the outside of the body. Therefore, after activity, core body temperature will always be higher than rectal temperature, somewhere between 1 and 3 degrees Celsius higher, depending on the activity and the ambient conditions. With activity, muscle temperature can even be 1 to 2 degrees C higher than core temperature. We know that injury to tissues occurs when temperatures are 43 degrees C or higher. Therefore, a rectal temperature of 39 could indicate a muscle temperature of 43, which is severe heat stress or heat strain. Therefore, if you measure a rectal temperature of 39 degrees C, alarm bells need to go off in your mind, telling you that your horse might be too hot. Again, effective strategies for cooling the horse need to be employed. Do not even think about continuing with activities. The damage that can occur with excessive heat stress, resulting in heat strain or heat injury, can initially be subtle. However, it is also quite severe. Horses may collapse, and some horses have died because the dehydration and heat stress was ignored. Remember from part 1, horses are not like us. What is fine for us can be very stressful for horses. Most horses that have experienced heat injury will take months to recover, and some never recover their former abilities. So why take chances with the well-being of your best friend? The fifth and final part of this video series will describe some practical ways for rapidly and effectively cooling your horse. Thank you.